Loss of breastfeeding does not mean all is lost. It does not mean that. That losing breastfeeding is hard, but it doesn't mean everything's lost. In fact, the bigger piece is still quite available because they, first of all, still have the relationship with their babies. And most importantly, their ability to form a secure attachment. And that, from a developmental standpoint, is the most important. I'm going to even go so far as to say that secure attachment supersedes breastfeeding as a parenting goal. Okay, and you might think, oh, God, how can you say that? Hi, everyone. Welcome back to session 3 of our topic on social support. This is the Science Chick Report, and I'm Dr. Kathleen Kendall-Tackett. So we're going to kind of finally hit this last topic, which I think is an important one, which is how those of us who work in the perinatal health field can support mothers who are unable to breastfeed. And again, like so much of our focus is helping mothers do that. So it's kind of hard to know, can we do anything in a situation where, for whatever reason, things didn't work out? There could be a variety of reasons. It could be bad advice. It could be some kind of physiological issue, whatever the issue is. Now, some mothers are just fine with this. Breastfeeding doesn't work, okay. They just kind of move on. But other mothers, and I've met many, many, many of them over the years, that will be in their 60s, 70s, even sometimes 80s and tell me, yeah, I tried, I just couldn't do it. And they really do feel such sadness about it. So how can we, as lactation supporters, help them move beyond this and move in a constructive way? I think actually we do have an important role here because we're the people who try to support breastfeeding. We do our best to kind of get in there and help mothers accomplish this. But we also can acknowledge that it doesn't always work for people. I think it works more than a lot of people would like to say. But there are situations where it's just kind of beyond everybody's control. And it's like maybe we see a mom, but she's gotten such bad advice that it's taken several times, of bad advice for somebody to kind of she finally gets to a point where her milk supply is dwindled so much and it really is too late to bring it back. But that's hard. And I will just admit that. So let's talk about kind of what are some constructive ways we can support. And I think actually there's quite a bit we can do that can help her move forward in a way that feels positive and constructive. Okay, so let's talk about, kind of how women feel. And this was, again, a quote from Amy Brown, who's done a lot of the research on this. And she said, women are increasingly told that formula milk is a comparable substitute for breastfeeding. While formula may feed the baby, women's desires to have their bodies work does not go away just because they can formula feed. Women's desire to mother in a way that they want does not go away because they can formula feed. And again, I think, a lot of times there's very little acknowledgement of that. People kind of are like, well, yeah, well, what are you complaining about? Now you can go out and do all this stuff. And, we have this stuff that you can feed the baby. And yeah, it's true. I mean, I'm glad that the product is better than it used to be, and so that there is an alternative. But that still is a hard thing when you really wanted to and you couldn't. Okay, so here's the thing that I want to really help mothers refocus on. Loss of breastfeeding does not mean all is lost. It does not mean that. That losing breastfeeding is hard, but it doesn't mean everything's lost. In fact, the bigger piece is still quite available because they, first of all, still have the relationship with their babies. And most importantly, their ability to form a secure attachment. And that, from a developmental standpoint, is the most important. That developmental relationship with the mother and the baby, or caregiver and baby, some of the literature talks about, is the critical thing that actually has effects throughout the lifespan. And that part is still very much on the table. Okay, so I'm going to even go so far as to say that secure attachment supersedes breastfeeding as a parenting goal. Okay, and you might think, oh, God, how can you say that? Well, I'm saying that because, first of all, if breastfeeding is going well, it does help support this. But we got to remember that when we first started talking about attachment back in the 1950s and 60s, most of the babies in this country were formula fed. And most of the babies in England were formula fed. And yet this still happened. Okay. And this kind of is research that kind of came out of the aftermath of World War II, when these babies were in these orphanages. And according to the behaviors, they had everything they needed. They were fed, they were fed, they were clothed, they were housed, and yet they were dying. And, Bowlby and, others kind of stepped out and said, well, I think they need an emotional attachment, and they got really like razzed for that. They got professional harassment about that. People did not want to hear it. Okay. But they persisted, God love them. They persisted and they believed they were right. They were absolutely right. Okay. And a secure attachment they discovered was absolutely important to have that caregiver there. So John Bowlby was in England, and his American counterpart was a woman by the name of Mary Ainsworth. She's the one who developed the measure of how you measure attachment. And those two were a couple of colossi that just took over the field in terms of helping to understand it. So there's been thousands and thousands of articles written on secure attachment. So again, I want to kind of show you a few of these, and I want to actually show you that while breastfeeding can facilitate it, if breastfeeding is going poorly, it sometimes can actually undermine it, which is surprising to people. It was a surprise to me. But the key thing about this idea is that the secure attachment is not only not, not frivolous, it is absolutely essential to survival and even beyond food and shelter. Okay. If babies do not have this, they're more likely to die. That's a fact. Okay. So how can we help focus mothers on that bigger picture, which is this, and kind of, walk out of there feeling like, okay, I did my best. I'm sad this didn't work out, but we're going to move forward and I'm going to be a competent mother because I know this, this, and this. Okay, so that's what we want to aim for. That they can still acknowledge, yeah, this was a loss and they feel it. Okay, but they want to actually be able to feel okay about this. Okay, so when you think about it in terms of parenting goal, you got breastfeeding here. Okay, but really the bigger picture is secure attachment. Okay, so that's really what we want. Breastfeeding, as I said, facilitates that or can. Okay, but secure attachment is where all the action is at. Okay, so let's talk about kind of what that is. So we want to shift the attention to secure attachment without minimizing the importance of breastfeeding. Okay, so as I kind of said in the book, I said a secure mother-infant attachment is not the consolation prize. It is, in fact, the prize. It's the goal. It's the thing you want to move toward. Okay, and it's quite attainable without breastfeeding. Now, normally, obviously, we wouldn't recommend that. But remember, all of that studies were done on formula feeding mothers. So can you get there without breastfeeding? Yes, yes. So that part is good news. Okay, and it comes from one thing: responsive care. Okay, so professionals can help mothers navigate this time by teaching them the importance of secure attachment, but always helping them care for their babies in responsive ways. And you can do this also too with partners, with grandmothers. The whole family can get involved. Okay, so when people kind of talk about, okay, why is this important? I was looking for some kind of summary because a lot of this research, they started really pretty much in the late 50s, early 60s, went all the way through to 1991 was the last article that Bowlby and Ainsworth wrote together. But I was trying to see, okay, so in that time since, what have we learned? And so this was an article I found from the British Journal of General Practice, and it was talking about kind of what it is. It said it's the emotional closeness that binds families. That's important. Prepares children for independence and parenthood. And again, I think this is just critical. We've got kind of a whole generation of kids that kind of lost out on, a lot of school experiences and things like that. But if their parents are strong, chances are they weathered that storm versus a lot of kids are kind of adrift because this was not sort of priority in their family. But it creates something that's really important. Developmental psychologists love to talk about this, the internal working model. If you want, it's the sort of framework. It's the filter how we look at the rest of the world. Okay, so do we think that the world is a safe place where there are people who will love and care for you? Or do you believe that the world is a harmful place and a dangerous place? Now, depending on your experiences, if you were raised in abusive situations, your internal working model is very much that the world is a dangerous place because that's what you learned. Okay. But what we want to do is shift and get away from that. This is, like when you talk about therapy for abuse survivors, we want to change that So they start learning to trust people more. That's one of the things to kind of get out of that, is to change that framework. Okay. And also, too, we talk about the construct self-efficacy a lot. Self-efficacy is critically important. We limit it in the perinatal field by talking about breastfeeding self-efficacy. Yeah, and that's all fine and good. Okay, kind of like breastfeeding, kind of, can you work your way out of problems? Can you, navigate systems? Can you figure out how to get the help you need and support? Do you feel confident that you can do it? Those are all elements of self-efficacy. But it has a much bigger role in health than you might think. I remember kind of when I was reading, I was working on a book looking at the health effects of trauma. And I ran into some articles I thought were very interesting. And they were talking about people living with HIV. Okay, so it was kind of back in the early days with treatment. And, treatment at that time was very difficult. You had to take medications at, exact times, and you had to take this dose, this, and this, and so it was a complicated medical regimen. But if you didn't adhere to that, your viral load went up. And anyway, what they found is when they try to figure out, okay, 65% of people are not adhering to this thing. It's basically life and death. Okay. And they said the difference was self-efficacy. So in this case, self-efficacy became the difference between life and death. Same thing with, adherence to diabetes medication, adherence to medication with autoimmune disease. I mean, so there was a number of things where it was absolutely critical. So it's a much, much, much bigger thing than we talk about in the perinatal field. Okay, but self-efficacy starts here with the secure base. Okay, so this idea, and I'm sure you've seen this, you probably remember this with your own kids. You're sitting someplace and the kids go out and they explore, and then they come back, and they explore and they come back. Well, that's what's termed the safe base. That they learn to go out and kind of do stuff independently, but they know there's a safe base to run back to. That's the roots of self-efficacy right there. Okay, so again, you can teach this to adults, which I think is good because sometimes not everybody has that kind of family situation. Okay, but this is where it comes from right here. So see how critical all this stuff is. But also, too, it's important in terms of safety, stress regulation, adaptiveness, and resilience. So, in other words, if there is a secure familial bond, you can weather stuff like living in a dangerous neighborhood or surviving a natural disaster. The parents buffer a lot of that family relationships buffer bad stuff that happens. Even people who've gone through horrendous stuff, it still buffers and they can come out with their mental health pretty much intact. Okay, so that's how important this is. Okay, and so this is what Ainsworth and Bowlby said in the last article they wrote together before they both passed away, is that a secure mother or caregiver infant attachment requires two things: mother or caregiver proximity, so that you're near, and you're responsive. Okay, so all this stuff that comes out of behaviorism that tells you don't respond, better not, you're going to spoil your child, is absolute rubbish. It's rubbish. And yet somehow that still prevails, and somehow we still get this advice. Parents get this advice. You get this advice about sleep. I mean, it's ridiculous. Okay, but responsive care is that thing that actually promotes attachment. Okay, and they said that the very things that we a lot of times try to extinguish, crying, suckling, smiling, clinging, those are the things that promote that togetherness. Babies cry out when they want to be with somebody. You say, yeah, but I just fed them. Okay, but maybe it's social. Maybe they're bored. Maybe they're just not comfortable laying on their back all day. So crying is not something we should try to distinguish. We should listen to it because they're trying to say something. Okay, and that in fact separation activates this, and it activates a specific part of the brain, and we see this in all the different mammals. So it's something called the anterior cingulate cortex. It's part of the limbic system, but it's actually the kind of bridge between the cortex thinking part of the brain and the kind of more they call the lizard brain. So if you think about the brain like this, and the cortex is on top. Okay, so you have this thing called the separation distress call. And in human beings, like if you're socially rejected, like if you're excluded from groups or you're bullied or whatever, that same part responds in your brain. Okay, but you see that across mammals. And it's this idea that we need to be in packs. And if we're not, we're vulnerable. Okay, but starting in infancy, separation activates all those behaviors to get whoever the caregiver is to come near. Okay, so this is what Darcia Narvaez from Notre Dame said, and she's talked about this in terms of, you know, this is kind of an anti-cry it out article, but I think she describes it very well. She's a developmental psychologist, but she said the mother and child are a symbiotic unit that make each other healthier and happier in mutual responsiveness. And again, part of it is she was talking about, like if children are not responded to, they're more likely to develop stress-based diseases. I mean, there's really quite a huge literature on this, and yet people still get this advice. It blows my mind. Okay, so why is it important? Well, we kind of talked about this a little, but bottom line is this, because it creates resilience, which is very, very important because bad things happen out in the world, and it creates self-efficacy. And early attachment is related to adult functioning and also adaptivity. So how well can you manage situations that are different than what you expect? Okay, so kind of a more recent article. It was a systematic review of 33 studies. Okay, so this is kind of what it came down to, that securely attached children believe they are worthy of care and comfort. The caregiver is the secure base. They can explore the world and come back when to safety, when distressed. And they balance between proximity to the caregiver and exploration. And they're confident that the parent is available. And again, if you have that confidence, you are more willing to go out, try things, you know, try and do something badly, but get up and try it again. So it's really important in terms of learning skills that you will need later in your life. But they said resilience is moderated by both internal and external factors. And they said that strong and stable relationships facilitate that. Okay, so again, you come down to you have that core of those strong relationships. Okay, and then that actually changes all the stuff around you. Okay, so what is resilience? Well, the internal factors include things like affective regulation, and this is the thing that babies need, especially in that kind of early time. They can't regulate their nervous system themselves. So that's why they need an adult to help them regulate their crying. If they're crying, after we've ruled out that they're not hungry, that they're not in pain, that they're just kind of overwhelmed, we need to help them regulate that. So we can do it by walking them, talking to them, the things that we kind of know to do. Okay, so that helps them regulate when their affect gets totally out of control. And so that's going to be a good thing later in their life because, a lot of the kind of chronic pain type disorders are kind of related to very dysfunctional affect regulation. Mood repair, when they get very upset, how can they pull themselves back to be kind of in a more neutral or happy state? The self-esteem, what do they think about themselves? This doesn't mean making them spoiled. It means making them feel like that they're worthy of care. But the external factors are things like stable relationships, family closeness, and partner support. Okay, so this is again talking about the construct of attachment across the lifespan. Okay, and all of these are related to that first bond. Okay, but also too, it protects adults, or children and infants when they experience adversity. So, like this was looking at, having babies whose mothers are depressed. Okay, we have a lot of literature on the effect of that, and we found breastfeeding actually does help with that. But this was actually not looking at breastfeeding and looking at babies who had secure attachment. And what they found is that these babies had less of a stress response. That inflammatory response is telling them that they're stressed. Okay, and that's good. You don't want that chronically activated. Okay, so again, even though the mothers were depressed, even though that's stressful for babies, they were not reacting that way because they knew the mom was there and secure, even if she was depressed. Okay, but they found that caregivers are the external regulators we just talked about until they can get to the point where they can do it themselves. So that's what we're doing. We're teaching them. And again, that's why I said it makes me so crazy about this cry it out stuff because they're like, babies need to learn to do this themselves. They can't. Okay, we need to kind of help them with this until they can. Okay, and they're going to be a little bit older. Okay, so they found actually that babies who had insecure attachments, on the other hand, had more salivary inflammation when exposed to the mother's stress or depression. So, in other words, when they saw sort of this negative affect from others, they had more of a stress response. And again, also to suboptimal caregiving also changes the way the HPA acts. Because again, remember, you're laying down neural pathways here. So this is going to be kind of how the brain interacts with the world for now on. Again, it's not to say that you can ever change this, but it's harder to. So it's better to lay down positive pathways. Okay, so it can also hamper the ability to regulate the inflammatory response. Okay, and that is actually a scary thing because that is related to all kinds of health problems. And those health problems start showing up actually pretty early. Okay, so another one, they were looking at, the amniocentesis. These mothers had amniocentesis at 17 weeks, and then the babies were assessed at 17 months postpartum. Okay, so this was actually kind of an interesting study. So they were looking at the relationship between high prenatal cortisol exposure. Okay, so that's usually a sign that there's depression or stress with the mothers. And then seeing, like at say age 2, how they perform on the Bailey scales of infant development. So these are kind of the gold standard developmental scales. They don't do them right away, because they have to be a certain age. Okay, but again, so you're thinking about something that's going to have an effect a couple of years hence. They said, now what's interesting is even though these babies were exposed to this stress, if they had a secure attachment, they performed well. That was the thing that made the difference. Now, again, I would actually bet if we did the study another way and said those who actually were exclusively breastfed, I would expect to see a similar thing. Okay, but this is not looking at breastfeeding at all. So you got everybody, you probably got some breastfeeding, some not. But they said if the baby had a secure attachment, they performed well on those scales, but that was not true for the ones who had an insecure attachment. So again, you're getting an idea of how important this is. Okay, another group here that you don't tend to see high breastfeeding rates in, although that's changing. Low income African American in a public health or public hospital. But they found actually if children were exposed to abuse, assuming from the non-primary caregiver, if they had secure attachment, it lessened the chance that they're going to get PTSD from that. So again, it was resilience. It's a type of resilience. That's sort of a little backwards way of saying it. But if the children had insecure attachments, they were much more likely to get PTSD in the wake of that. Okay, now I thought this was interesting because this was in the journal Health Psychology. And they don't necessarily look at things like attachment. That's more of the developmental psychology things. But they were looking at a sample of adults, and they found that if they had a secure attachment as infants, they were less likely to have adult health problems. Okay, so here's what they did. They had a birth cohort study, which means that, everybody that was born, say, in a certain hospital at a certain time, they get enrolled in the study. Okay, that's a birth cohort. Okay, so it wasn't a huge size sample, it was about 200 and something. But what they did is, at 12 to, if they followed them from infancy, and they found at 12 to 18 months, they measured attachment. Okay, and so they said if the babies actually had an insecure attachment at 12 to 18 months, by the time they were age 32, so that's how long the study had been going on at that point, they already had inflammation-based diseases. So what that is suggesting is you have this activation, chronic activation of the stress system. Okay. The fact that these were already showing up at age 32, I think is remarkable. I won't probably live long enough to see it come out at 40, 50, or 60, but I suspect you'd even see a bigger difference. Okay, so looking at stable relationships and the effect on that, it says the stable relationships do not have to be with the primary caregiver. That in fact, they could be with family members, teachers, therapists, and they provide the same protective effects. Okay, and again, like I said, this is something that came out in a really interesting resiliency study. It was the Kauai longitudinal study. And they found that, some of these kids were in some pretty challenging circumstances. There was poverty, there was drug abuse, there was just all kinds of stuff. But they said if they had one adult who cared about them, that these kids managed to weather that. It's not necessarily that there were no issues, but that that things actually overall worked a lot better, and they were more resilient. And so again, like I said, that book that was written about that is called Vulnerable Yet Invincible, and it was saying that, and this is kind of basically saying the same thing. Okay, so Kind of interesting. Looking at some studies about feeding method and bonding, they're not quite exactly what we would expect, because we're all kind of like, yeah, you got to have, in order to have bonding, you got to have breastfeeding. No, that's not necessarily true. In fact, this was a study from Israel, and this is Hairston. She's actually done a lot of stuff around depression and breastfeeding and sleep. And I think she was a little surprised by these findings. Okay, so she had 270 moms, and the babies were 1 to 9 months old, and they were in a postpartum community sample. But they found that breastfeeding was not associated with mother-infant bonding. Okay, and this is why. If the mothers had a negative experience, they were more likely to have bonding difficulties than those who didn't breastfeed. So again, the quality of the mother's experience makes a difference. It drives me absolutely nuts when I hear mothers tell me stories about how, yeah, they were told, yeah, I'm having all this pain and it's really difficult. And everybody's like, you have to keep going no matter what. That's ridiculous. First of all, I think that's cruel, but it also doesn't pay off because you can see kind of downstream effect is they were less likely to be bonded. And I mean, doesn't that make sense? If it's miserable every single time you interact with your baby, what kind of vibe are you going to be putting out for that baby? Are you going to be just enjoying each other and stuff? No, you're not. So it's really kind of shows you why it's important that mothers have a good breastfeeding experience. But I think also too, it kind of says, there's times when probably the better thing, the preferred thing would be for mothers and babies to not breastfeed if it's just gotten to be that miserable. Like I've read some regimens that mothers are putting themselves through, and I think, oh my gosh, you would probably be better off not, pumping, and it's painful all the time, and it's just, it's kind of like, okay, I'd say maybe let's back off on that, truthfully. If they want to continue, maybe they can do one pumping a day or something. But making yourself miserable, I think, is just really counterproductive. And as providers, we need to know that the quality of the relationship makes a big difference and the quality of that experience. And if it is hard, that we address it, obviously. Okay, but they found out that the mother's bond with their children will not be negatively impacted if they do no breastfeeding. That's what she concluded. And that's kind of shocking to a lot of people in our field because they think, oh, well, that helps. Well, it does. But remember, you can get there without breastfeeding. Okay. Another study was 99 community-based women. This has been in the U.S. And they looked at breastfeeding and bonding as well. And it came down to this. It's kind of same thing as the Hairston study, the maternal subjective feeding experience. Again, the mother's subjective experience. It's kind of like it's her subjective experience of sport. Very important. Okay, so the subjective feeding experience was more important than feeding type. Okay, so if they had a good experience, then they were more likely to be bonded. And so again, it predicted bonding at 6 months if they had a positive experience at 3 months. So the more positive the feeding experience, the greater the bonding. So this is kind of where we need to kind of head with moms. We want them to feel okay about their choice or whatever situation that they ended up in, that they're doing this thing that's going to help bond with their babies. Okay, also study from Germany looked at prenatal depression increases the risk of formula. Yeah, we've seen that a lot. But impaired bonding was also, you can see how this feeds this, associated with mixed feeding. So again, things are kind of maybe not going well, or, that they're not kind of connecting with the baby. They may be more likely to disconnect, and just think, okay, well, we'll just have somebody else feed, or I'll just do this, and kind of disconnect from the babies. But they also found in this study, which I thought was interesting, that if they used formula, the mothers were even less sure that their babies had enough to eat and would gain enough weight. So again, this whole idea of this market being pushed of, yeah, the baby's got to have formula because then they'll know exactly how much, and they'll know for sure they're getting food. Yeah, that's kind of not what the studies found. Okay, so what we want to do is kind of let's talk about some behaviors that they can do that are responsive and support secure attachment. Okay, feeding behaviors and physical contact. And again, this is going to be also something for partners. Okay, so we want to look at the mother's current routine, and we want to aim for her having a pleasant, not awful experience. Looking at this pumping schedule, these moms that are putting themselves through these terrible pumping regimen, okay, we can probably back off on some of that. Triple feeding, oi, let's don't even get me started. If you want to do that briefly, that's fine. But sometimes, because of social media and stuff, people get convinced that's the thing they have to do. Okay, so what's responsive feeding? Well, one type, of course, is using a supplementer. Okay, so again, mimics breastfeeding, gives, also sends kind of oxytocin to the mom because of the suckling at the breast, but also paced bottle feeding. Because again, you're trying to do something that is the most close to breastfeeding. It's not the same exact thing, but the baby is in control of how much they take in. That's the key difference. Okay. And then in terms of non feeding ways to connect, there's two ways. I think Babywearing, has been around for a long time. This is true. You see tons and tons and tons of literature on this. It's a great thing to do. But also infant massage, the research on that's really quite good. So mother infant touch, they were looking at the effects of skin to skin and caring. Okay, so this goes beyond that kind of early newborn period. He said mother infant touch, provides kinesthetic stimuli, social interaction. And for infants, it affects their sleep organization, temperature and heart rate, crane and collie. And we know a lot of this from the kangaroo care studies, of course, attachment quality and development, and the mother infant interaction. So again, it really does kind of help all these different things. Okay, and also it's based on this idea of contingent responsivity. So the baby, responds, the mother responds back. The baby makes a response, the mother responds. So it goes back and forth. So it's not just like, one of them all the time, or, the other. Sometimes mothers come in and they're not like watching the baby's cues, or sometimes not the mothers, other relatives. I've seen this when I've been out places. Somebody, auntie comes along and the baby's doing everything but saying, put me down, and the baby's turning sideways, the baby's arching, and they're kind of, oh, yeah, he's fussy, isn't he? Well, he wasn't fussy with his mom who was paying attention to him. Yeah, we're going to, it's hard to not say something when you're sitting, like trying to enjoy your afternoon. Okay. Now this is one of my favorite studies of all time, just because I think it was just such a neat little design. And talk about something simple you can do. Okay, so this is with a group of moms. They were low socioeconomic status. They were from an inner city. They were all at risk for child abuse and neglect. Okay, so really serious stuff here. Okay, so half of them were assigned to a soft baby carrier, and half were the kind of infant buckets. Okay, so they when they came back and compared them later, compared to the mothers with the infant seat, mothers in the baby wearing group. So this was, I think, about 3 months later. Mothers in the baby wearing group were more responsive to their infants at 3 months. Okay, so what that did, just that simple act of saying, okay, wear your baby for a few hours a day, the mothers were naturally more responsive. It encouraged that in them. And again, I think there's some oxytocin effect of having the baby near, and the smell and the touch and the kinesthetic stimulation on the chest, which increases oxytocin, all of these things. Okay, so they were more responsive. But also by 13 months, when they measured attachment, the babies were significantly more likely to have a secure attachment. So again, you want to talk about a simple, cheap intervention. This is brilliant. Okay, found in a more recent study, kind of did a similar thing. So randomized controlled trial with teen mothers, 41% of them were Hispanic, assigned to Babywearing or reading to their babies. Now the reading is good, obviously. Okay, at 2 to 4 weeks postpartum. Okay, and then they assessed, not with the strange situation, which they normally have to do with 12 to 18 months. They used another assessment, which is the infant global rating scale. So it's a newer assessment of attachment. Okay, so that was at 7 months. Okay, so they found more hours of Babywearing was positively associated with secure attachment, and the fewer hours was more correlated with the disorganized attachment in the baby. So that's not the good one. You don't want that one. Okay, so again, like I said, a simple thing. You have these young moms, they're not very experienced, but this is something very easy, and it's something that partners can do. It's something that grandmas can do. It is all good. Okay, so obviously infant massage, another really kind of interesting thing, has been around for a long time. A 20-week program where they did with mother infant dyads. It was a 20-week RCT with 60 mother infant dyads. Mothers in the intervention group were trained in massage in the first 4 weeks, and the training was pretty minimal, sometimes minutes. But babies in the massage group gained more weight at both 8 and 20 weeks, which is good because, again, it's downregulating the stress system. It's either the kind of the fight or flight or the grow and thrive response. Okay. And then mothers in the massage group were also more securely attached at 20 weeks and had higher self confidence. So obviously, this is extremely good. It's been used a lot with babies in NICU. So these are good things, but it can be used in lots of situations. Look, the study is actually Turkish. A lot of good research coming out of there. That Ilmaz, she's done some really good stuff on birth trauma. I like this one. This was a program in South Florida. So again, very, multicultural group down there, but they did infant massage and singing. These were mothers that were in substance use programs. Okay, so again, substance use, I mean, this is a pretty high risk for, abuse and neglect and all kinds of other problems. And they compared it to either there was parent education or they did a parent education plus massage versus usual care. So they did this kind of program for about 5 weeks. Okay, so they had it in several languages. They had it in Spanish, they had it in Creole, they had it in English. And so they did all these things. They found both interventions. Okay, so both the talking, singing, education, and education plus massage decrease stress and depression. Okay, so again, those are both good things. Okay, they both increase connection, but infant massage group had significant improvement over time compared to, say, parent reading. Okay, so again, I think there's a physiological reason for that. That type of touch, where this is oxytocin. We've known that for a long time. Also, too, it lowered the stress, and that was reflected in the mothers. Okay, so the mother's stress was lower, and that was reflected in a reduction in the waist to hip ratio. Okay, so oftentimes when that ratio is higher, you have a gain, a weight gain around the middle. The mothers actually found that it was actually lower. Okay, and that when it's a higher, it's a symptom of metabolic syndrome. So it actually operated on that system and actually dropped that cortisol down, which actually helps reduce that gain around the middle. So again, I think a lot of mothers would be on board for this, but they didn't find any kind of sustained effect for the other groups. Okay, and another one looking at mothers of preterm babies. Again, we've seen a lot of studies like these. These mothers were given 8 minutes of instruction. Okay, and they were given this. These mothers were assessed for anxiety the day before the babies were discharged. Of course, their anxiety is going to be really high. They got randomized into either massage or control, given 8 minutes of instruction. So we are not talking about a lot of, money that needs to be involved or time or especially equipment. We always try to think we need these big old programs when there's some stuff that's actually fairly simple to do. But they did find anxiety was significantly lower in the mothers in the massage group, which again makes sense. You're turning off that stress system. Okay, and what we need to recognize is I'm kind of wrapping up here, is when mothers are unable to breastfeed, they are at higher risk for depression. We've seen that. And so by kind of steering them in this direction, we're going to kind of help with that. And if we can support mothers while they grieve and help shift their attention to parenting behaviors that will lead to lifelong benefits for their babies, we're actually also going to help reduce their risk for depression. Okay. And I think the main thing is we must offer hope beyond the current situation, because I think there's a tendency when breastfeeding doesn't work out for whatever reason to think that it's all lost. And it isn't. It isn't. It's amazing how many times in life we get a chance to do things differently. And this is one of those times, and I think we have a unique ability to be able to speak some truth into this situation and say, look, it's okay. You did your best. I am sorry that you lost this breastfeeding experience, but let's move on from there and think about kind of what else your baby needs and how you can help them thrive and grow and how you can grow and thrive as a mother. I think that that's really important. So, with that, I'm going to wrap up. I hope you enjoyed this little triptych, and I will see you next time. Thank you very much for tuning in. And, let me know what you think. Feel free to send me an email. And again, reminding that all of these lectures came from this book that I wrote for parents. Breastfeeding doesn't need to suck. Whole idea about that book was that I wanted mothers to have a good breastfeeding experience. And now we have some nice research that shows why that's important. It is. So until next time, I will see you then, and let me know what you think when you get a chance. And I hope this is helpful in your work.